Thanks, everybody. As I said, I've missed seeing you all on Wednesdays. It's, my professional life has been overtaken by COVID preparedness and response since last March. And so today I'm just going to give you a series of updates, but I want to leave time for questions. As usual, I'm a font of basic information, not a lot of in-depth information, because that's not my forte, but I can usually get answers from staff on some of the in-depth issues if you have any questions. So our case numbers right now, we've got an interesting mishmash of cases in town. You're all aware of the Hanover Terrace outbreak, which was brutal for that entity, which had worked so hard with us to avoid COVID in their units. But unfortunately, it looks like a volunteer from outside their community asymptomatically brought COVID to Hanover Terrace. 7 individuals have passed away. 2 additional residents are still seriously ill. All of their staff are now back to work for the most part, but they just had another case number 69 out of 73 residents, diagnosed yesterday. So it's been a long haul for Hanover Terrace. I think they've really appreciated the support they felt from the community, because so many people reached out to provide moral support and goodies and resources for them. But you can imagine the staff, the residents, and family members are clearly stressed. And, you know, this hits close to home because the first individual who died of COVID at Hanover Terrace was Sean Mulholland's mother-in-law. Sean's the city manager in Lebanon. So I felt this personally because I'm a close colleague of Sean's. And so, when those things happen, they just sort of hit close to home. We also have had an interesting time with Tuck students who have been somewhat less careful than we would have liked in adhering to social distancing and masking. We now have 7 students with confirmed cases of COVID, Tuck students, isolating. This is because they continue to have these little evening soirees, and you have an evening soiree, and this is what happens. So while we don't have many students on campus right now, Tuck students are here, and 7 of them are sick. We also have 1 undergrad who's sick with COVID and isolating in the lodge, and a whole bunch of other people who are now quarantining because of those potential exposures. We also just Christmas Eve, I got the first call that our first town staff member had been diagnosed with COVID. One of our dispatchers, we have 8 dispatchers. Within 48 hours, we had 2 more dispatchers down for the count. We now have 5 dispatchers who we've pulled from rotation, 3 because they're ill, 2 because they worked with dispatchers who were COVID positive. And we're also down 2 firefighters who acquired COVID. We're not sure how. So we had to pull a whole duty crew of 6 people off shift rotation for the next 10 days. When you only have 8 dispatchers on staff and you've got 5 down for the count, that makes you pretty nervous. We're just praying we get through Friday when the first dispatcher who got ill can return to duty. But this is what we've been working really hard to avoid all these months. And unfortunately, there's so much community transmission of COVID out there right now in our region that it's just been increasingly difficult to avoid COVID. We, in addition, have a number of families in town who are now quarantining because they got together with other friends or family over the holidays and then got the word that somebody they gathered together with was diagnosed with COVID. So Michael Hensley, our health officer, who's busier than a one-armed paper hanger and has been since last March, is doing a lot of sort of just family guiding and educating as they reach out to us to say, help, Aunt Josephine has been diagnosed with COVID and was with us on Christmas Day. What do we do? So it's a fair amount of just educating citizens as they reach out to us. In terms of, as Jed just mentioned, Kendall's on lockdown because a staff member there tested positive and interacted with a couple of other staff members before they realized they had a case of COVID. So sadly, in any facility, whether it's the high school, Hanover Terrace, Kendall, Wheelock Terrace, an apartment complex with common entrances, town facilities, dormitories, when one person is sick with COVID, the contact tracing begins, and out of an abundance of caution, Kendall shuts down. Kendall has been superb in managing their response in an incredibly thoughtful and thorough way and working with us daily. And I think this is their fourth shutdown now, if not their fifth, since March. And they have a very detailed protocol they adhere to when they have a positive case. We're worrying now about a couple of upcoming time periods, and that is, okay, we're just about to send all our kids back to school next week, and you never know when kids may have been exposed to a family member who then turns out, or a friend that turns out to be COVID positive. So we know re-entry with the start of the public school term next week is fraught with risk, just in terms of bringing everybody back together again after they've been apart. By now, our schools, Hanover High, Richmond Middle School, Ray School, Marion Cross School, they have this down to a science in terms of if a student or a teacher or a family member is COVID positive, they're all split into pods. Certain classrooms then have to quarantine out of the school. Everybody gets tested. The governor has just created an expedited process for school students to be tested at DHMC and for those results to be reported quickly to minimize the amount of time a student has to remain out of school if their test is negative after potential exposure, and that's going into place as we speak. So this is going to, I think, make the start of the January half of the school year a little easier in terms of length of time students have to be out, but it makes for a ton of work on our part in coordination with the school district whenever there's a positive case in the schools. The other piece that we provide a lot of support to the districts on is what to do about youth sports, high school sports, games, and now we're heading into basketball season, which means we're indoors. And what does that mean? Because it's more difficult to kind of maintain positive airflow in a gym than it was out on a soccer turf or football field. So we've spent many, many hours in Zoom meetings and classrooms sort of thinking through with the schools and with our rec department how we enable our kids to remain physically active without increasing their risk of exposure. And I now know more about airflow in and out of our school buildings than I ever deemed humanly possible, because movement of air is considered an important component of sort of managing the potential for COVID to be airborne for any period of time in a space. So a lot of work has gone on in our school buildings to facilitate that. We're also working closely with Dartmouth because students are about to come back. And unlike the fall, when we had the first-year students who were still relatively obedient and compliant and wary of breaking the rules, the students who are coming back for winter term are juniors and seniors. Oh, so wise at how to beat the system and less inclined to pay attention to the rules. And by rules, I mean signing a community expectations agreement over your conduct in the era of COVID and ensuring that you're socially distancing, that you're masking, that you're getting tested on schedule, that as soon as you arrive, you get tested and you go into a 10-day quarantine. We're nervous because this incoming group is I think just potentially, and they may surprise me, but I think potentially going to be more challenging to manage in terms of COVID preparedness. We've worked extremely closely with the college on the messaging to the students who are coming back, but we have a lot of students living off campus who don't always pay as close attention to either the messaging or the community expectations agreements they've signed as the students do who are living on campus. The college does a really good job of managing their on-campus students, and I think they'll continue to do that through the winter. It's the off-campus student population that tends to be a little bit more challenging to oversee, and that also tend, therefore, to fall into our sort of enforcement and bailiwick than the colleges, because the college can't track them closely. So we're anxious, and yet we weren't so anxious that we were tempted to say to the college, sorry, you got to be fully remote in the winter. I just think we're prepared to take a deep breath once they all officially start their term here, which is they're coming back on the 15th and 16th, but their term starts on, I believe, the 7th. We know they're gonna start coming back this weekend, because many of them living off campus have leases that start January 1st. And even though the colleges said don't come back until the 16th, 15th and 16th, I bet you a week's worth of lunches that we'll have a whole bevy of students starting to come back on Saturday of this weekend. And so we hold our breath and just pray that they go into quarantine. Now, the kids who live in New England don't even have to go into quarantine, right? They're not required to quarantine for 10 days. But students who are coming from outside of New England do. And we saw this past fall that they were not very good about doing that when they were living off campus. So we're preparing for a lot of what we call knock and talks. We've worked with the landlords. We've prepared messaging that the landlords will be posting on all the units and trying to manage that. And, the challenge for me and for my staff this whole sort of summer, fall has been we feel a little schizophrenic. On the one hand, we don't look forward to students coming back. On the other hand, we do, because our downtown retailers and restaurants desperately need customers. And so we're working fairly thoroughly with especially the restaurants, who are also nervous, to figure out how they manage their seated indoor patrons. And we're also, I'll briefly in a minute tell you about a new business that's being launched to help with food deliveries, but for takeout. But we're all just holding our breath. And I think we're going to see, I think it's very likely that we're going to see some spike in cases here locally come middle of January, simply by virtue of the fact that we're going to have a lot more people moving into the cabin from outside the cabin. And it's going to take a while for that to all settle down. We've spent a lot of time working with vital communities and with a series of regional partners, including the Upper Valley Business Alliance, which, if you recall, is the now merged Hanover and Lebanon Chamber, and our economic development partners in the Grafton County Economic Development Council based in Plymouth, the State Community Development Finance Authority staff, and officials with the State Department of Economic Development to provide funding and information for businesses as they were trying to survive. And so especially Tracy Hutchins and Tammy Klotz at the UVBA have done a really great job of keeping the lines of communications open with businesses and providing business support and counseling for businesses that were trying to figure out the PPP program, which is the Payroll Protection Program, the EIDL program, and other state grant programs that were made available to provide support to businesses over the last 6 months. And now that President Trump signed the second COVID relief or CARES Act bill, we're all getting briefed on what components are in that bill that we will be able to help make available to our local businesses. Unemployment compensation will go up by $300 a week. Folks making less than a certain amount of money will get at least $600 checks from the government, maybe more, depending on what happens in the Senate. But more importantly, the PPP program is extended. The EIDL program is extended. There are grant programs for performing arts venues. There's a new round of SBA funding. So we're all getting briefed on those components and talking about how we can connect our businesses with that information as quickly as possible. You know, that aspect of economic development support is something that I personally enjoyed jumping into because it's very hands-on, it's quick support, and it's tangible. You can see tangible results. And it's really helped to bring us together with our downtown businesses on a day-to-day basis in a way that we haven't had to interact over my time with Hanover. And I think the downtown business owners have been so incredibly appreciative. They're no longer seeing the town as just the regulatory entity, the planning and zoning entity, the sort of licensing entity, the parking entity. We're in a help mode in what's been a really satisfying way, and even including our downtown holiday programs, which we launched on a harebrained scheme because I'd spent too much time watching Hallmark holiday movies over the Thanksgiving holiday and thought, oh my gosh, we can do this in downtown Hanover. And I have to say, in 2 weeks' time, we pulled together lights and wreaths and huts and music and stuff, tchotchkes and Christmas trees, and everybody sort of leaped into it, including the restaurant and retail owners and the Improvement Society and the UVBA and our Parks and Recreation Department. And I think we all needed that sort of fun shot in the arm. And so we're continuing that program through January, changing the light colors up to soft white and blue from the holiday colors. And you see stars have been installed on our street lamps that are blue stars that will light up, and just trying to kind of keep downtown warm and inviting and make it as festive as possible in conjunction with a winter wonderland theme that the Parks and Recreation Department and the college are doing to encourage students to get outdoors. So fun, positive silver linings here that we've been able to implement. And we're also now planning for vaccine dissemination. The Lebanon Armory is now open as a vaccine center for the Upper Valley. Currently, only individuals who fit in the 1A category, which are high-risk patients in congregate care facilities, medical care providers, and first responders, police and fire, are just now receiving their vaccines. Our firefighters and police officers, the first batch of them got their vaccine, phase 1 vaccine yesterday. Same for Hartford, same for Lebanon, same for Norwich. So our first responders are getting their vaccines, and our medical providers and long-term care facility patients started getting their vaccines last week and in earnest in the long-term care facilities this week. Once those individuals receive their first doses and their second doses, which will be 3 or 4 weeks from now, depending on whether they got the Pfizer vaccine or the Moderna vaccine, they'll start to move into the 1B category. We won't start to see general public vaccination happening until, my guess is at the earliest, March. But once that starts, it's going to roll out, I think, fairly briskly, and we'll be showing up at the Lebanon Armory for our vaccines. But communities are also working on possibly standing up additional vaccine centers in what are called our pods, points of distribution facilities, which have been in existence for the last 15 years. The pod for Hanover would typically be Levron, but that's currently the testing center for students for COVID testing. So we're likely to collaborate with Lebanon on a separate pod, potentially at Lebanon High School. For now, however, I think the Lebanon Armory will be the place where we go for vaccines. And then ultimately, we could be going to our primary care providers for the vaccinations. So we have spent numerous Mondays in meetings with the state and our public health region on the vaccine dissemination plan. And the advice we're getting from the state continues to be modified as they gain more experience with the most effective way to disseminate the vaccine. And quite frankly, they're still struggling with getting a straight answer in terms of how many doses they can expect to be delivered to the state on a regular basis. They were told we were getting 20,000 doses, and somehow those doses got cut in half between when the message came out about numbers of doses and when the deliveries actually happened, which causes the state to have to step back and say, hold on, slow down the deployment because we don't have as much to disseminate as we thought. So there's been a fair amount of hiccup challenge in this first round, but I think over time that's going to get ironed out as all the regions gain more experience in how to do this effectively. The only other thing I would say that we're beginning to think about right now, no sooner had we gotten through the general election in November, which was the third election we ran in so many months, and we, the granddaddy of all elections, we have to start thinking about town meeting, which for us typically happens in May, and we're beginning to think about how we're going to conduct town meeting this year and where, with the state continuing to give us refined guidance on what we can do legally to make that happen. And also waiting to see how the New Hampshire legislature is going to convene, because they are not in agreement about how they're going to convene yet. And a lot of us at the local level have a lot riding on what this legislative session may do or not do relative to providing more financial support to cities and towns and adopting a state budget. So that's a lot I just threw at you. Questions, guys? Let her rip.
Julia, so great to see you again.
Good to see you, Nan.
Major kudos for how wonderful the downtown looked and sounded and everything. I'm sure it made a difference, but it sure looked nice. And thank you for doing that, and for all that you and Marty and Mike Hensley and everything are doing. It's a lot more than wondering how much salt to order for the roads, eh? A lot of learning curve. So my question is the numbers and how they are reported, because I never ever see numbers for Hanover that say more than 11 cases or 15 cases, when we all know that there have been 70 cases at Hanover Terrace or so. Yeah. And so much of planning is based theoretically on data and what numbers are going up and down. And What's the deal? Why does Hanover never, and I know it's not you, but why does Hanover always show such low numbers?
Yeah, I mean, I've given up, Nan, with using the state database because to me, it doesn't correlate with our reality on the ground. It's based on a very complex process that the state uses for registering a positive case in a community. So, for example, the Hanover Terrace cases, they never carried the full number of cases that were present at any one time amongst the residents of Hanover Terrace. And for any employee who was diagnosed, if they don't live in Hanover, they're not carried as a Hanover case. They're carried as a Plainfield case or a Bradford, Vermont case or a New London case, depending on where they live. So we keep a running tally, which is a combination of the COVID dashboard that the college maintains is very accurate for college students, faculty, and staff who may either be in isolation or quarantine. Typically, if they're in isolation, that's a positive case. And you can track that dashboard. They update it daily, although they haven't updated it since December 18th because they've been on a 2-week vacation or closure. But by just going to covid.dartmouth.edu, and there it is. And it's a very accurate dashboard. And then Mike Hinsley and Rob Hausman and Ryan Borkowski and Marty McMillan and myself keep our own sort of running informal tally of cases we're aware of that may not be carried on the state website for whatever reason. We always have more cases than the state says we have by 3 times.
Which just makes you wonder, when decisions are made based on cases and
right.
Anyway,
right.
I know you're doing a great job.
It's never been accurate, and I get lots of people emailing me and texting me saying, "How come the state says we only have 12 cases today when my count is different?" Right? And stop looking at the state dashboard. The state dashboard is helpful for taking a look at the trends statewide and countywide over time. And the good news is Grafton County continues to have the lowest positivity rate of any other county in the state, which means fewer cases as a percentage of total tests are positive, which says less community transmission here per capita than in other parts of the state. And that pattern continues to track pretty consistently. But the caseload numbers for Hanover, in my mind, are never particularly accurate.
Well, if you stop testing, think what your numbers would be, Julia. Thank you.
That's the Donald Trump approach. Kevin Wenger, I see your hand up.
Hey, Julia, what have you heard about the testing? What I've heard from a lot of parents is that the kids go to school, the school sends them home for like a runny nose or whatever, but then they can't get tested at DHMC, and Clear Choice tells them it's like 3 to 5 days to get a test. Yeah. It seems like the testing is still really a bottleneck for everybody's daily life.
Yeah, and Governor Sununu, Kevin, just announced yesterday that they've created a special queue for any student who's sent home, either because they're potentially exhibiting symptoms or because they may have been exposed to somebody who came back with a positive test. They go to the front of the line at DHMC for a rapid test and result. So because the frustration was, just as you stated, kids would try and schedule an appointment to be tested. It might be 2 days before they could get in, and then it might be 4 or 5 days before they got a result, which means they're out from school for a week, perhaps unnecessarily. So they're now bumped to a new super fast queue at DHMC and APD for the rapid test result, with the notion that we want to get kids back into school as quickly as possible. So you'll see that now roll out as our own kids go back to school starting next week. to try and reduce the bottleneck for school students. And that's elementary, middle school, and high school. The college has a great testing protocol with very rapid results and a really good system for notifying students, faculty, and staff if they have a positive result. So the college's testing is top notch, but the state supported testing for our school students has been somewhat lackluster, and the governor's trying to change that.
Question on a website for like the Lebanon Armory, you said there's like 1A, then 1B in the distribution of the vaccine. Is there a website to go to? Like, what is 1B, which would be the next? What would that entail?
If you go, the state's COVID web pages are very informative, Denise. And if you just go to nh.gov and click on their COVID website when you get to the state's homepage, it'll take you to all sorts of information, including who's in 1A. They have not yet fully defined who's going to be in 1B.
Okay.
And that's because there's still a fair amount of jockeying going on in terms of the state prioritizing individuals based on the number of doses they anticipate they will have. So, for example, 1B is likely to include home health care workers, emergency dispatchers who work in the public safety setting but aren't necessarily in contact with patients, family members of individuals living in long-term care facilities, older people with health conditions which deem them to be higher priority than, regular folk, and also some other types of frontline workers. So, for example, just this morning I was dealing with an email from one of our wastewater treatment employees who is considered a frontline worker, as are our public works department folks and all the people who are driving snow plows and those sorts of things, as well as retail and restaurant workers who are out there in contact with more members of the public than your average resident. Should they be considered higher priority because of the relative risk associated with their job? To date, the state has not published the list of who will be in 1B. We think that will be out in the next week or two. But as I said, they're still trying to weigh relative priorities in the context of what they're hearing from Washington about the amount of doses they can expect to receive week by week. For most of us, as Rotary Club members, we're going to be in the sort of level three general public, but anybody who's got a higher risk factor relative to health issues may get bumped into level 2. I think you're going to see level 2 immunizations start in February. For level 3, meaning general public immunizations, not until at least March. And, some have said not until this summer. I think now it all depends on what the Biden administration is able to do once they take over the reins of the national vaccine program, to make some crucial decisions about what's going where when.
Thank you.
Yep. But nh.gov COVID webpage, they've also got a lot of interactive pages on their website, so you can actually look at the map by town and by county. Although, as I said to Nan, the numbers for Hanover don't reflect the numbers we know that we're dealing with on the ground. So the numbers the map is only as good as the numbers are, but the relative interaction between communities and counties is really, for me, often very helpful data.
So, Julia, you're so popular, I've got to look at 2 screens to see everybody's faces. And I noticed in doing that Bill Young has been with us. Bill, I'm sorry I didn't introduce you as a guest earlier. I have a letter here that came into the club from Bill. Let me see. I got to see myself so I can show. So this came in from Bill, Hartford Parks and Rec. Dear Hanover Rotary members, sadly, we will not have an Ockham Pond party this winter. The pandemic has changed our lives. Thank you for the guidance and support over many years. Your members embrace the cold and hard work to serve the winter. I can't read it. Sorry, Bill, I can't read your handwriting. The solstice is here, and with it, more sun, more hopes, and less virus. Sincerely, Bill Young. Any other? You're as popular as our Fox News pollster, Julia.
Oh man,
and that's a high bar.
I don't know whether I should be excited or depressed.
Yeah, it's a topic that obviously is on everybody's mind. So, any other questions? There, I got one from Bruce there.
Yeah, if I could change the subject, you were talking a little bit about planning and downtown businesses. I think earlier on your website, the planning committee or something had some documents about some downtown plans, and there was a survey, and it had some sort of radical ideas about parking and bike lanes and bike boxes. What's the status of that project?
So that project is ongoing, Bruce. We're continuing to try and encourage people to take a look at the survey, complete it, give us feedback. What's triggered this conversation is that our downtown sidewalks are really past their useful life in terms of just the overall condition of the concrete, the pavers, the bricks, the curbing, and it's time to replace it, which would be a big project. Timing would be critical in terms of not disrupting customer flow for our downtown businesses, and we've been mindful of that. And it's not an inexpensive project, but we also have a lot of interest in changing up the way our downtown streetscape works. And we saw this summer with all the outdoor dining we facilitated that people really liked it. And so we're looking at, okay, what do we do to try and be all things to all people here? We want on-street parking, but we want more space for outdoor dining. We've got more folks who would love to see safe and viable options for bicyclists. What's a small town to do? And so we will continue to seek community input on this for the next several months. This is not a project that we are planning to implement effective next fiscal year, which would be after July 1 of 2021. It's likely to be a 2022 project at the earliest, both in terms of cost, but also tough to get really great input in a pandemic. So it's not as if this is a going, gone sale. We'll be looking for input and trying to figure out creative ways to engage the community online over the next 12 months. We just have lots of competing opinions about what we should do in the process of updating our sidewalk system. So stand by, news at 11, plenty of time for further input. You'll see more information appearing on the website over time as we look at the costs of various approaches, but also engage different user groups in the community.
Jinya, you had your hand up.
Thank you. I wanted to second Nan's comments about the fabulous job that Julia has done. It really, I think, has been awesome. And secondly, I don't want to ask you to confess. I will only say that I hope you were able to get vaccinated, because we really need you around safe and healthy. Thanks.
Yeah, I'm not. I'm in phase 3, Jinya, so I don't qualify. And I have to say, I mean, I'm pretty locked down at home. I've been in the office every day, but we're very careful here in the building, and I am not out and about in any way, shape, or form the way our frontline staff are. So I'm just fine. But trust me, just as soon as I'm eligible, I'll be stepping up, because I want that Moderna vaccine just as much as the rest of you do. And I'm looking forward to getting that needle in my arm whenever we can do it.
Just a quick, did you tell us about the new business that's forming about food delivery?
Oh, no, thank you, Nan. So last September, I asked Tracy Hutchins at the UVBA and the staff at Vital Communities if we could pull together a group of restaurants and retailers, but particularly restaurants, around local food delivery. One, because we were getting complaints that folks were trying to use Uber Eats and things weren't arriving, things were cold, things were outrageously expensive, and this wasn't working as a person seeking to have food delivered. And two, knowing that once it got cold and restaurants couldn't operate outdoor dining, the key to their success over the winter, their survival, was going to be takeout and delivery. So, in fact, the UVBA and the Vital Communities pulled a small working group together, and sure enough, a business is about to be launched called Uver, U-V-E-R. Jarrett Burke and John Pepper have been the brainchildren for this launch. It is going to be a locally owned and staffed restaurant food delivery service, paying a living wage to its delivery staff and not charging an exorbitant delivery fee for door-to-door delivery of restaurant meals. I got to tell you guys, I learned a lot about the whole food delivery empire that has surfaced in larger urban areas that is pretty predatory and is really kind of negatively impacting restaurants. I had not fully appreciated the sort of business plan that those entities have implemented until I got schooled, and it was fascinating and made me even more committed to doing what we could to support our own local food delivery business. Grubhub and Uber Eats may be really smart business plans, but they tend not to be of benefit ultimately to the restaurants. So that business is just about to launch. And Tuck folks have been involved, Tuck students have been involved, Vital Communities, and some entrepreneurs who are investing. And I'm excited for the restaurants because I think this could be a really great game changer for the Upper Valley. And it's locally based. So stand by, guys. Pretty soon you're going to be able to order your meal from Molly's and have it delivered. And, Boloco is already doing deliveries. Luz is doing deliveries, but each restaurant has been doing their own, and that's somewhat problematic. This is meant to be a shared food delivery service that we can all access and utilize that hopefully is going to encourage us to eat more. Which we don't need to be doing, but what the hell? I mean,
Someone in my household doesn't like that idea.